Almost every third person we meet suffers from some kind of hair problem. Today I'll be telling you something about androgenetic alopecia. As the name suggests, andro stands for androgens, which are the male sex hormones. But they are not exclusive to males. They are also found in females, in a proportion and quantity much less as compared to males. And genetic stands for the DNA, the chromosome, the genetic background of an individual, which he or she inherits from her parents. So, androgenetic alopecia can be defined as genetically predetermined, androgen-dependent, progressive thinning of scalp hair, which occurs in a specific pattern. Therefore, it is also known as pattern hair loss. Now, genetics plus androgens combine to result in three pathophysiological processes. First, hair cycle alterations. Second, hair follicle miniaturization. And third, perifollicular inflammation and fibrosis. These three pathophysiological processes combine to result in hair loss, which is known as androgenetic alopecia. So, the first one, hair cycle alterations. A normal hair cycle consists of three phases. The anagen, which is the growth phase. In this phase, the hair increases in length and diameter. The catagen, which is the transition phase, and the telogen, which is the resting phase. After this phase, the hair is shed. So, in our hair, in your normal scalp hair, most of the hairs are in the phase of anagen. They are in the growing phase, and only very few hair are in the telogen phase, which are shed daily. So, but what happens in this androgenetic alopecia? There is hair cycle alteration. So, most of the hair are shifted from anagen to the telogen, and therefore they are subsequently shed, resulting in an alopecia. This is the first thing what is happening. Second thing is that hair follicle miniaturization. As the name suggests, mini means small, and hair follicle miniaturization means the hair follicle gets smaller, and so does the hair. So the hair gets smaller in length, finer in diameter, smaller in length, finer in diameter, to a point that it gets so small and so thin, hardly it is visible with the naked eye. And so what we see is a bald patch, but the hair is still there. It is still there, but it's so small and so thin that it is not visible. Third thing which is happening is the perifollicular inflammation and fibrosis. Our inflammatory cells, WBCs, what we say, gather around the hair follicle and produce inflammatory mediators, resulting in fibrosis. And this fibrosis around the hair follicle prevents the hair from growing. Now, so as I have previously told, that this is also known as pattern hair loss. So it presents in a specific pattern. In male pattern hair loss, there are two kinds of pattern. The first one, the hair loss starts in the temples region, bitemporal, and in the crown. This is the most common pattern. Second pattern is the anterior pattern, in which the hair loss starts on the anterior and slowly progresses towards the back. The grading of severity of the male pattern alopecia can be done on a scale which is known as Norwood-Hamilton scale of male pattern alopecia. The females may present with three patterns. The most common pattern is diffuse thinning of the scalp hair, and the frontal hairline is preserved. But in some females, they may present with male pattern type, or they may present with Olsen's Christmas tree pattern, in which the frontal hairline is breached. The grading of severity of the female pattern alopecia can be done on two scales. The first one is the 3-point Ludwig scale, and the second one is the 5-point Sinclair scale. Now, we come to the treatment. Lots of treatment have been tried for androgenetic alopecia. Like, people have tried green tea, caffeine, they have tried several vitamins, minerals, oils, millet seeds, low-level laser therapy, etc. etc. But do they work? There is no sufficient data that these treatments really work in androgenetic alopecia. They work for some but not for others. We don't have any proof, we don't have any evidence, but there are 4 treatments which actually work. We have the proof, we have the evidence, they have worked in the past. So what are these treatments? Let us see. The first one is the minoxidil. Minoxidil comes in the form of a solution or foam. It is actually like an oil. You just have to take 1 ml of the solution. It comes with a dropper. You can just take 1 ml of the solution and apply it like an oil to the areas where you're getting bald. Once in morning and once at night. Now, once you start applying minoxidil, initially in 1 or 2 months, there is a paradoxical effect of hair fall. So, the patient comes to us with like, doctor, you have given minoxidil solution and we are getting more hair loss. So this is actually normal. You don't have to panic. You don't have to worry about it. It will get, this is the way how minoxidil works actually in hair loss. So at 3 or 4 months after you start the application, you will start getting results. The hair loss will decrease and the hair will start growing, because minoxidil actually converts all the hair into the anagen phase, and the hair, which is the growth phase of the hair cycle, and the hair starts growing. The results, like, as long as you keep applying minoxidil, you get the results, and as soon as you stop it, again the alopecia reverts to its pre-treatment levels. So if you want the result for lifelong, you need to keep applying minoxidil lifelong. Second treatment which actually works is finasteride. It comes in the form of tablets. The standard dosage of finasteride being 1 mg for males. So the third treatment is hormones, but only in case of alopecia with females. Hormones are not given in the case of androgenetic alopecia in males. And the last treatment is surgery. In surgery, the treatment used nowadays is follicular unit hair transplantation. Now, this is the androgenetic alopecia in a nutshell with Dr. Nishant Makhija. If you have any queries regarding anything, consult your nearest dermatologist. Thank you for being with me.